am Ritika Soni, Mental Health Mission India. Firstly, I would like to welcome all of you on this platform of Mental Health Mission India, as we have here today with us Miss Yashushwanshi, who is a magnificent counseling psychologist and also a founder of this NGO, Sampoorna Manonsthiti Mental Health Association, known for her sincerity and devotion to the subject and her field. So we are here to talk about how to overcome the psychological or emotional issues that we have been facing as audience, as public, and as residents, basically, in this pandemic. So, ma'am, getting back to you, how do you think, what are the types of problems that people are facing in this pandemic, in this scenario? All the emotional problems or psychological?
Thank you, Ritika. And once again, being associated and connected with Mental Health Mission, I'm really thankful for this opportunity. As far as your question goes, the kind of psychological and emotional problems that people have been facing these days, um, to begin with, fear, anxiety, guilt, sadness, and people have reached the highest peak of procrastination, something they are unable to deal with, dealing with the stigma of COVID within their families, around for their own selves, the kind of emotional distress that they're going through, anger, and a plethora of much more emotions and feelings, and most importantly, being worried about the persistence and possibility of death. So, if on a large scale, I have to say that what are the kind of problems, these are the emotional and psychological issues that many people are going through. I mean, let alone about the children or the old age population, but at large, this is what it is.
Okay. So in that case, ma'am, what do you suggest or as to how these people can overcome this anxiety and helplessness around themselves, especially when we talk about the COVID patients themselves?
Right. So about this, I would like to highlight three aspects, right? The first is self-care, the second is simple psychosocial care, and the third is seeking professional help. So when I have to begin by saying self-care, everyone has this, concern around themselves, that how am I supposed to take care of myself with the ongoing situation. So first of all, every individual needs to set boundaries about how much they can take, be it personally or be it professionally. While whether you're affected, whether you're not affected from the virus, or if you're recovering from the virus, you don't have to take a lot on your shoulders, right? Be realistic about the physical, the emotional, and the social boundaries you can have around yourself. Then coming down to the kind of psychosocial care, simple psychosocial care. If anybody is having these concerns, talk to them about their needs, talk to them about what they require, assist people with their basic needs, basic needs related to food, water, anything. Let them know about the various services that are available for their help. And also try not to give them medical advice all the time, because it can be overwhelming for the person who's going through it, right? And most importantly, if possible, try to help them feel calm. And then coming down to the kind of professional help people can seek. So if you think somebody is, what happens mostly at home, people are not in a zone or are not comfortable enough to share their feelings. Sometimes they are the source of strength of the family, so they cannot really open up to their own family members. Sometimes they don't have the opportunity to open much around, to the people. So when the concern actually reaches to a level when it starts interfering with your functioning of the daily life, then it is very important to seek professional help.
So, ma'am, the main big question that we have for our viewers is as to how would you suggest that these people, anybody, affected or not, how
Mhm.
can they maybe maintain or do something for their own happiness and well-being for that matter.
Yeah. Absolutely. So there are a lot of strategies that people can follow, right? But I would like to discuss few interventions which audience at large can follow, right? Some things need to be done at physiological level, some need to be done at psychological level. So starting with the basics first, drink a lot of water. I'm not saying that drinking water takes away your fear or anxiety, but it will give you some space to feel something physically in the beginning. And then, second most important is breathing. There are many breathing techniques available. It is very important to give some space to your mind. Proper breathing in and breathing out is very important to channelize the energy in your body. Then, as far as psychological techniques are concerned, people can practice, grounding techniques. There are several grounding techniques that are there, but I would like to talk about one which is called as the 5 4 3 2 1 method. What this means is that you might start by listing out 5 things that you can hear, 4 things that you can see, 3 things that you can touch, 2 things that you can smell, and 1 thing that you can taste. So this is the easiest grounding technique a person can perform when they're feeling highly anxious, right? Yet another strategy is to check for facts. For example, if someone is experiencing breathlessness, a lot of times what happened, they directly concluded to the fact that okay, this is because of the virus. Or if they're not having the symptoms, they will start thinking in that direction. If they are already going through it, they might feel that okay, this is a trigger to a next level problem. But sometimes we need to check facts in the way that the simple uneasiness that one might be feeling, or the breathlessness, could also be related to something else. It could be related to something, it could be about the posture you are sitting in, it could be about gastritis. There are various other things that are also symptoms happening alongside. So checking facts become very very important. Then, last but not the least, I would like to talk about Newton's first law of motion states over here. Right. So, what it states is that a body that remains at rest, right, or if in motion, it remains in that motion at a constant velocity. Now, why, people might be wondering, why am I stating science over here? The reason for that is, this is specifically to introduce the importance of body and sleep routine, right, and the hygiene. So we have to rest when we are going through the problem, we have to rest, that is for sure. But gradually it is very important to introduce our body to movement. Certainly after 12 to 14 days of rest, a person might be feeling a lot of restlessness within. But one can start with simple breathing, simple stretching, and then eventually moving on to activities that will help their body recover faster.
All of you that just all of it that you just said was actually making sense word by word. Thank you so much for joining us this time. And yes, to all our viewers, we will be joining you all soon with some new ideas, with some new issues. And till then, we wish you all the best and with the best of your health. Take care. Thank you.